I will continue now with Dr. Knubi Katerini with successful treatment of corticosteroid-induced cutaneous atrophy and dyspigmentation with heterologous type 1 collagen.
Good morning. It's always a pleasure to be here at IMCAS in the City of Lights. My topic for today is about regenerative medicine treatment. Steroid-induced atrophy is a well-known complication, and even though typically self-limited, can be distressing to patients. We present a female patient, 26 years old, with Fitzpatrick skin type 4, with lateral epicondylitis. I have to mention here that the patient is champion in water skiing, and lateral epicondylitis is a painful condition of the elbow due to overuse or repeated action of the muscles of the forearm near the elbow joint. So, the patient was treated for the lateral epicondylitis by a specialist with topical steroid injections. She did 3 injections once every 2 months. After the first triamcinolone injection, the patient experienced mild discomfort but no atrophy or dyspigmentation. 1 month after the second injection, the patient experienced progressively worsening cutaneous atrophy, transparency, elasticity loss, pigmentary changes, sensitivity, and skin fragility. 2 years after the third injection, the patient presented to us. She had complete pain relief. She was not suffering from lateral epicondylitis any longer, but the clinical examination demonstrated a 5 centimeter in diameter lesion with significant cutaneous atrophy, transparency, elasticity loss, hypopigmentation, and overlying telangiectasias at the region. Here is how the patient came to us. Numerous methods have been proposed for treating atrophy following a steroid injection. Autologous fat injections, fat grafting, hyaluronic acid fillers, pulse-dye laser, or bacteriostatic saline injections. Now, the underlying mechanism following atrophy after steroid injections is not completely understood. It has been hypothesized to involve decreased fibroblasts and collagen degeneration. And steroid-induced atrophy will often resolve with time, but patients are understandably unwillingly to wait for a spontaneous resolution. And so was our patient, even though it took her 2 years before she came to us, and she wanted a solution. So, we proposed, and she willingly agreed, to try an innovative regenerative treatment based on heterologous type 1 collagen injections. For the last 30 years, heterologous type 1 collagen is being used in dermatology, angiology, vascular surgery to treat skin ulcers, open wounds, scars, and bed sores in the form of a lyophilized collagen patch, which is being applied directly on the lesion. In vivo and in vitro studies show that heterologous type 1 collagen stimulates the formation of new fibroblasts, production of collagen type 3, and neoangiogenesis. Therefore, heterologous type 1 collagen is the first choice treatment for skin regeneration. Now, for several years now, a powder formulation with the same active ingredient is used widely in cosmetic medicine and anti-aging treatments, as it produces optimal conditions to restore connective tissue. What is the mechanism of action of heterologous type 1 collagen? Heterologous type 1 collagen powder, in order to be injected, is dissolved in normal saline. Specifically, we use 100 milligrams heterologous type 1 collagen dissolved in 5 ml normal saline. And collagen is a protein, and once it gets dissolved, it hydrolyzes in tripeptides and amino acids. More specifically, heterologous type 1 collagen gets hydrolyzed in tripeptides and amino acids. Tripeptides, on one hand, act as dermal growth factors to the old fibroblasts, and through mitosis, we have the production of young fibroblasts. And then, the amino acids are being used by the young fibroblasts to produce collagen type 3. On the other hand, tripeptides block the action of metalloproteinase. What did we do to our patient? 100 milligrams heterologous type 1 collagen powder was dissolved in 5 ml normal saline. We injected this solution to the affected area. We injected 0.1 ml per point intradermal or directly subdermal at approximately 0.5 centimeters interval. We used a topical anesthetic cream before the injections. We used 30-32 gauze needle, 4 millimeters. The patient received 4 treatments once every 2 weeks. In every treatment, we used 100 milligrams heterologous type 1 collagen. This is the result after 4 sessions. We see the improvement. After the first treatment, we had a slight improvement in the clinical appearance, and after the third treatment, the lesions practically disappeared. There is no relapse for about after 5 years since then, and there were no side effects, and the patient reported minimal to moderate pain. Since then, we've treated several cases with steroid-induced atrophy. This is one more case. This is the result after 3 sessions of heterologous type 1 collagen. Now, given the fact that heterologous type 1 collagen is being used in dermatology, plastic surgery, and other medical fields, given the fact that heterologous type 1 collagen can treat steroid-induced atrophy with good results, we propose heterologous type 1 collagen as a safe and effective treatment for anti-aging treatments. Thank you very much.
Thank you so much.
Thank you.